Okay, so let's go ahead and get started with your exam then, okay? I did just want to ask you a couple of questions. So you were saying that you had a fall, and I do see that laceration on your forehead. So are you having any sort of external pain? Any pain kind of around your head or around the area? Like a 4 out of 10, okay. And did you black out at any period while you were down? Okay. So no loss of memory or anything. Very good. And you said you've never had a cranial nerve exam performed, correct? Okay. I'll just go over a few things with you so you know kind of what to expect. Okay. All right, so essentially what we're going to be doing is testing your 12 cranial nerves. Basically, I'll be going by a chart here. I have several things that we're going to be testing, so I do like to have a visual just so we don't miss anything. Some of them tend to kind of interconnect, so we won't necessarily be performing 12 separate tests, but I will make sure that we get everything tested, okay? So I want to begin just by doing a quick visual inspection of your face. Aside from this very obvious laceration that you have on your forehead, I'm not seeing anything externally that I'm concerned about so far. If I could have you just sit up straight with your shoulders kind of plainly as you would be sitting day to day. I just want to see if there's any kind of difference in your muscle tone or if you're leaning from one side to the other. I'm not seeing any signs of any kind of atrophy in your neck or head. You don't appear to be swaying or have any kind of tremor. Okay, I did see that you have a history of seizures, but you haven't had one in quite a long time. Okay. Well, if you don't mind, I would like to go ahead and jump into the physical portion of the exam. We have quite a bit to go over today, okay? All right, so I'm going to come a little bit closer to you, and I will be touching your face throughout the portion of the test. If at any point you are uncomfortable, please just let me know. To begin with, I'm going to be shining a pen light in your eyes, and I want you to just start by looking directly at the middle of my face, okay? It is very bright. I apologize. It's going to be uncomfortable. If at any point it becomes painful, please let me know and we can take a break. Okay. Okay, so just looking at the center of my face. I'm just going to test for pupillary reaction and good. So far I'm not seeing anything that I would consider abnormal. I know it's a very harsh blue light. Very good. Still looking at the center of my face. You're doing great. Okay, coming from the bottom. Good, okay. Good, okay. So if I could actually have you look over at this chart. Perfect. Good. Good job, okay. Now I'm going to have you look in the opposite direction. Good, you're doing good. Okay, so now I want you to look just kind of over my shoulder. I'm going to come very, very close with the light, okay? Looking for any abnormalities there, but I think we're okay. So I didn't notice any lagging or any differences from one pupil to the other. They are the same size. You're tracking okay. You did have a little bit of what I would consider a pain response in that eye, but that's honestly to be expected given that you have the laceration. I would imagine that side is a lot more sensitive. Yeah, okay. Well, that looked okay. So why don't we go ahead and move on to eye movement. And this is testing the same cranial nerve, but we're going to be doing a little bit of muscle movement. So I want to see how your eyes are moving overall and if there's any pain, particularly on the one side, okay? Okay. So what I'm going to do is first have you follow my pen with the light on, and then we'll do with the light off, okay? So I'm gonna move back a little bit. Can you still see the light? Okay. So I'm just gonna move it around, and I want you to just follow it with your eyes. Try to keep your head still, okay? Good. Still having a little discomfort on this side. Yeah, I can see the wince when we kind of go over this way. Is it more uncomfortable the further over we go? And then not so much here. Okay. So now with my light off, I want you just to continue to follow. Good. Less uncomfortable with the light off, okay? And then follow in, close, close. It's a little blurry there. Blurry, okay. One more time. And here, okay. So aside from the discomfort, your reaction to that was normal. So let's go ahead and move on to another part of your vision test. And what I'm going to be doing is showing you some Ishihara test plates. And essentially these are color test plates, and they will help me determine whether or not you are colorblind, okay? So let's start off with a practice. So this is a control. You should see a number here. Can you tell me what this number is? 12. Yes, that is a 12. How about here? 29. And here? 74. Very good. And here? 45. Very good. Do get a little harder as we go along. So, can you tell me what this number is? 2. And here? Yes, correct. That is I don't want to trick you. There's not actually a number there. How about here? 16. And then here, there's not a number, but I do want you to reach out and trace that for me if you can. Perfect, okay. Very good. And your last one, tell me what that is. 35. Very good, okay. Very good, so no issues with that. I'm not suspecting that you are colorblind. All right, so let's go ahead and move on. And I think actually the last thing I want to test for your vision is your peripheral vision. So what I'm going to do is have you look at the center of my face, and I will be holding up a couple of numbers on either side. So for example, you're looking here, I'm going to ask you how many fingers this is, or we'll do the other side. My hands will kind of move around, and I want you to tell me what numbers you see, if any, okay? Okay. So center of my face, 2, 3, very good, 4, 2, I know it can be a little difficult, good, good, good. It's a little harder on this side. Now, are the numbers on this side blurry at all? It's just a little more difficult. Okay. Doing great. You haven't missed any yet. Perfect. Last one here. Good. Okay. So you didn't miss any, but you did say that it was a little uncomfortable on that side. Okay. Alrighty, let's go ahead and move on, and let's see. The next thing I think I want to test is why don't we move on to your sense of smell? I have a couple different things that I want to test here for your sense of smell. And just to make sure I didn't see any allergies listed. Okay. Perfect. I would hate to have you smell something that's going to end up making you feel sick. So I have a couple different things here. This isn't labeled for you to be able to know what it is, but I'm going to be dipping this in, and basically I want you to tell me what the smell is, okay? So let me just mix this up a little bit. And these are both pretty common, like everyday smells, so it's not really to trick you, it's more so just to have you let me know if your sense of smell is working. Sorry, just getting this mixed up. Okay, so it should be good. Okay, so let's try occluding one nostril. I'll let you decide which side you want to occlude first. Perfect. So I'm going to bring this up to your nose, and I want you to tell me what the smell is, okay? Can you tell me what that is? Again? Sure. Citrus, perfect. Was actually lime, so citrus falls into that category. That's perfectly fine. Do another one here. A little bit of it on there for you. These are pretty potent, so it doesn't take very much. I'm just going to have you occlude the other side. Perfect. And what does that smell like? Cinnamon. Very good. Yes, that is cinnamon. Okay, and following along in the same line of testing, I'm going to have you taste something this time. So I just have a little essence here. So if I can have you stick your tongue out for me. Yep. I'm going to just kind of brush this on your tongue, and I want you to tell me what you taste, if anything, okay? Ready? Okay. Can you tell me what that is? Mint. Tastes like toothpaste. Yeah. Yes, this is an oral swab, and it's got a little bit of toothpaste on there, so that is correct. And I'll kind of let you wash that out of your mouth a little bit, and then I do just want to have a look. Perfect, okay. So if I could have you stick your tongue back out for me, I'm just going to have a look in your mouth. You say, having a look at your tonsils. Uvula appears to be midline. I'm not noticing any signs of tonsil stones. Back of your throat looks healthy. Hard and soft palate look good. Teeth look good. Do you see your dentist pretty regularly? Okay. And then if I could have you tilt your head back, just having a look at your nares. Okay. And I'm just going to include one nostril here. I want you to breathe in. Good. And this side. Good. Okay. Not noticing any signs of occlusion there, so that's perfectly good. Okay. So let's go ahead and move on. The next thing I want to test is actually your sensation. So I have a couple things that I'm going to test as far as your facial sensation. Let me just grab them. Okay, so let's start with something fairly simple. I have two cotton swab kind of Q-tips here with two different ends. So this side is very soft. This side is a little more pointy. And I'm going to start by having you tell me if you feel any differences from one side of your face to the other. So we're going to test here, 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 along your neck and your arms. And I want you to just tell me if it feels the same along both sides, okay? So I'm going to have you close your eyes. Tell me, does this feel the same as well as here, and here, and along your neck? Okay. How about by your ears and shoulders? Next, we're going to go kind of down your face. Does that feel the same? Perfect. So no loss in sensation from one side to the other. So now I'm going to have you tell me if you feel soft, which would be this side, or sharp, which would be the wooden side, okay? Now close your eyes. There you go. Soft. Sharp, very good. Sharp. Good. Good job. One more here. Good, okay. Good job, you didn't miss any of those. So the next thing we're going to do is very similar, but this time I want you to just say yes when you feel it. So this is a cold, soft metal, and I'll use different points of pressure. So you're either going to feel it very lightly, or I might push in a little harder. Either way, I want you to just say yes if you feel it, okay? Yeah. Good. Good. Sensitive there, but you did feel it, okay? Here. Good. Perfect. Again, you're doing very well. You didn't miss any of those. And the last thing I want to test for your sensation is something a little more obvious. So this is very sharp. It is a Wartenberg wheel. It's not going to cause you any pain. It might be uncomfortable around your eye. I won't be placing this anywhere near your laceration there, but I do want you to tell me if you can feel it in other areas, okay? Okay. Feel it there. Good. Good. Painful there. Is it still painful here? Or more so as we move this way? okay? Feel it there. Okay. But no loss overall. And did you notice any areas felt differently than others? It was all pretty much the same. Okay, perfect. Okay, so let's go ahead and move on to our next set of testing, which will be for your hearing. And again, I have a couple different things that I'm going to use. So let's start off with the tuning fork. So I have the tuning fork here, and essentially I'm going to be creating a sound, and I want you to tell me if you can hear it, and then we'll kind of move on from there, okay? So close your eyes for me. Tell me if you can hear that. Okay. You hear it on this side. Good. You hear that? And you hear it louder now. Good. Same thing. And then hear it louder. Okay. I want you to tell me when the sound stops. Good. Tell me when it stops. Perfect. Okay. Now, I'm going to be creating a series of light clicks, just like that, in your ears. And I want you to tell me how many times you hear it and on what side, okay? So sometimes it'll be a little louder. Sometimes it might be very, very low. If you hear anything at all, tell me how many times, okay? Okay. Good. Perfect. 4, good. 2. Just 1 that time. Okay. Good. Good. 2. Okay, perfect. Similar, but this time I want you to just say yes if you hear something, and it's just going to be a very light kind of puff of air, okay? 2. You hear it. Very lightly. Okay, perfect. The last thing I want to do for your hearing is to just do a little whisper test. So I'm going to be whispering a series of words in either ear. I'll have you turn your head in the opposite direction. I'm going to be including the one ear while I whisper on the other side, and I want you to just repeat the words after me, okay? Okay. I'm going to include this side. Basketball. Baseball. Soccer. Good. Just including this side. Volleyball. Track. Swimming. And you heard all of that correctly. Very good. Okay. Okay, well, I didn't notice anything abnormal with your hearing, so that's very good. And just to be sure, I want to have a quick listen of your heart. So I am just going to be placing this on your chest, and I want you to just breathe normally. Don't focus too heavily on your breathing. I do want to listen to your lungs at the same time, so just kind of relax, close your eyes, and I'll just have a listen. Okay. Good. So now I'm going to have you kind of sit up, and I want you to breathe in and now exhale. Good, one more time. Okay, and last one. Very good. Okay, so I didn't notice any abnormalities there. Your heart rate is normal. It's around 65 beats per minute, which is perfectly good. Lung sounds totally normal. I'm not noticing any kind of distinctive differences in your heart. Everything sounds good there. So I think the last thing I'm going to want to test is your kind of facial movements. So what I'm going to do is have you kind of independently move your head. So I want you to just repeat what I'm doing first. So if I could have you turn your head all the way this way. Perfect. And then all the way this way. And then as far back as you can. Good job. And then as far forward. Any pain or discomfort with any of that? Okay. Now we're going to do it again, but this time I'm going to have you met with a little resistance. So I want you to turn your head into my hand. Good. A little bit of pain there. Yeah. This side, not painful. Now I want you to move up. Good. And down. And the only place you were feeling a little bit of discomfort was kind of here in this area. Okay. Like I said, you are doing very well. I didn't notice anything abnormal or anything really of note. You passed everything essentially. So this is information that I will pass over to your primary care physician. If it's okay with you, I would like to have the nurse come in and just kind of clean you up a little bit and bandage that. I don't want to have you being posed to any risk of infection on top of everything else. Yeah. So we'll just kind of get you cleaned up a little bit. You don't need any stitches today. We might do a steri strip just to keep it covered slightly. But other than that, I think you're going to be okay. Yeah. Be a little more careful. I know it's hard, especially with these rainy days. It's easy to fall if you're not wearing the right shoes. Yeah, totally understandable. Okay. Well, thank you so much. I hope you feel better. And should any of your symptoms get worse or you do start to notice any blurry vision, especially, or dizziness, definitely try to stay awake, have someone take you to the hospital, and then we'll kind of do another evaluation from there, okay? Okay, well, thank you so much. I hope you have a good day.